My name is Dr. Rolanda Thomas, and I am a psychiatrist and will be discussing my patient's symptoms as well as providing a diagnosis for his symptoms and recommending a treatment plan that best suits his needs. My patient is Mr. Eeyore, a personal friend of Mr. Winnie the Pooh. Mr. Eeyore first came to my office complaining of severe symptoms of which I strongly agree is contributing from major depressive disorder. Some of Mr. Eeyore's symptoms include depressed mood lasting for several days at a time, a diminished interest and pleasure for activities that he once enjoyed and loved, loss of energy and extreme fatigue, which has reduced his physical movement greatly, constant feelings of guilt and worthlessness, an inability to think, concentrate, or make decisions, as well as frequent thoughts of death and suicide. According to the latest edition of the Diagnostic and Statistical Manual of Mental Disorders, my patient has experienced a presence of manic symptoms as part of his diagnosis and some minor anxiety distress. Based on the previous mentioned symptoms of my patient, my professional treatment recommendation consists of 1. A depressive medicine, such as antidepressants, serotonin reuptake inhibitors, which are SSRIs, which will help regulate Mr. Eeyore's mood, as well as electroconvulsion therapies, which are ECTs, which will create short electrical impulses into the brain, or by using a more alternative medicinal approach, such as medicinal cannabis, to help stabilize Mr. Eeyore's mood. My second treatment recommendation for Mr. Eeyore is therapy sessions, such as cognitive behavioral therapies, which are CBTs, or psychodynamic therapies, which should encourage my patient to change his negative emotions, thinking, behaviors, patterns, and feelings from more past experiences into more positive and pleasant emotions, behaviors, patterns, and feelings. And lastly, my treatment recommendation for Mr. Eeyore include changes to his personal lifestyle, such as eating a clean, more wholesome diet, engaging in more physical activity, such as including gym, Zumba, nature runs, and even yoga into his daily lifestyle, creating a social support system into his life, such as personal connections with close family and friends, as well as developing social coping skills to help relieve and reduce stress, as well as finding a more meaningful and purpose into his life, and lastly, getting an adequate amount of sleep nightly. So, to reiterate, Mr. Eeyore's symptoms are symptoms that are related to major depressive disorder. And based upon my best judgment, my treatment options should help Mr. Eeyore begin to have a more fulfilling life consisting of prescribing medications that will help stabilize his mood, such as antidepressants, SSRIs, and alternative medicines, as well as therapy sessions consisting of cognitive and behavioral, as well as psychodynamic therapies, and lastly, incorporating healthy lifestyle changes that will help Mr. Eeyore become a more healthy, happy, and healthier version of himself.